Let me introduce Dr. Richard Clifford. He's a senior scientist at the Frank Porter Graham Child Development Institute at the University of North Carolina at Chapel Hill, where he directs research and training programs. He's co-director of the First School Project. Dr. Clifford's training is in educational administration with specialization in political science and research. He has had experience as a teacher and a principal in public schools. For more than 25 years, he's been involved in studying public policies and advising local, state, and federal officials and practitioners on policies affecting children and their families. His work has focused on two major themes: public financing of programs for young children and the provision of appropriate learning environments for preschool and early school-age children. Please welcome Dr. Clifford.
Well, there's nothing like following Jack Shonkoff to get your stress levels up. I'm sure that my cortisol levels are off the charts right now. But there's no way that I can talk about all of those things or react to all of them in any way. And a number of them are well out of my realm of expertise. So you'll have to bear with me for doing a partial response. And thank you, Jack. That was a great presentation, and thanks more especially for all the work that you're doing now with the Center on the Developing Child, and all that means to our country, to North Carolina in particular. My job is to talk about North Carolina and the implications for decision making here. And I have to say, it's influenced. I would have had a totally different response 6 months ago than I have now. But I think the environment that we're in our financial crisis in this country and in North Carolina certainly are going to influence what I say this morning. So I'm going to say a few words about North Carolina and where we are now, about what we've done in early childhood policy and service delivery, and then about what's next. I think you know this. I'm going to be quick here, that North Carolina is a large state and growing state. We're the 10th largest state in the country, working our way toward number 8 according to the Census Bureau. We have about 120,000 children in each age cohort, so that means we have about 120,000 5-year-olds in North Carolina right now. So that means that there are about 600,000 children who are who are of an age below eligibility for entry into kindergarten. So it's a large number of children, and that number is growing. Our population of young kids is growing faster than our overall population. And the second point there is it's increasingly diverse. Some of you know my family reflects that diversity in America. I have 2 Vietnamese grandchildren and 2 Mexican-American grandchildren, one of whom arrived at my doorstep this morning just about the time I left, who was sick. We are the sick child care for my family. And so my wife wasn't particularly happy that I was headed out the door as she was headed in. But we do have a very diverse population, a population of Latin, Hispanic, Latino in North Carolina. Grew the most of any state proportionally in the 1990 to 2000 years, and that growth has continued to be quite dramatic since 2000. We know that, a third point, we know that they're investing large amounts of money. So early childhood is not just a drop in the bucket anymore. My best estimate now is that we're spending roughly $1 billion a year in state and federal resources in North Carolina on young children prior to kindergarten entry age. And that's a lot of money. That's, when you start getting into the billions, it gets much more serious. Yeah, that's true. On the other hand, that's not as much as it sounds like in North Carolina. We spend just about as much on kindergartners as we do on all of the children below kindergarten age. So that 120,000 kids, roughly a little less than that, in kindergarten now, we spend just about $1 billion on. The same amount we spend on those 600,000 children who are younger than kindergarten age. So while it's a lot of money, relative to what we're spending on children in general in North Carolina, we're not spending very much on the youngest children here. And Jack's chart that he showed about the return on investment from our expenditures being the greatest when the children are the youngest make us wonder about whether that proportion should be reversed, and we ought to be spending the most on the youngest children rather than the least. So, so that's where we are in a nutshell right now. And I'll say I'm going to be pretty quick here so that we can come back and ask some more questions a little later. So what have we done? We've actually done a lot in North Carolina, and Jack and others have made comments about that here. And I would rush to say that we've relied very heavily on research in making decisions about what we're doing in North Carolina. We've used research on teacher education and group size, on child-staff ratios, other structural features of child care that came out of a whole series of research studies that have been done in the U.S. looking at these issues to help us guide us toward a higher set of standards in North Carolina starting in the early 1990s. Studies like the Cost, Quality, and Child Outcome Study, the National Daycare Study, Child Care Staffing Study, Carolina Abecedarian Study that Jack mentioned, and the High Scope Early Intervention Studies. So we've had a whole raft of studies that have helped guide us in establishing policies and practices here in North Carolina. We've chosen to focus on the most vulnerable children first, particularly with More at 4. More at 4 in a very specific way targeted those children who are at the highest level of risk as being the ones that More at 4 was aimed at. Again, based on a broad array of research studies that have indicated that our best returns, but also our programs are most effective at dealing with children who are the most vulnerable. And vulnerable means children who are at high risk are much more affected by the quality of programs. So we've tried to focus on the quality of programs. We've started trying to track where are the most vulnerable children in child care. Are they in the worst quality, or can we make sure that they get into higher quality care, because we know that they are much more heavily impacted by the quality of care than my children were, for instance. Middle-class children are affected by it, but not nearly as much as high-risk children are. We've improved our kindergarten health assessment. We're doing this right now as a way of looking at health issues for young children and implementing a random sample for more accurately tracking the health status of children. This has become a much more important issue for us in recent times. We developed an early intervention system that is quite highly respected in the U.S., particularly looking at bringing children with special needs into inclusive learning environments. It's been a major focus in North Carolina. It's been quite successful. So we've done many things in North Carolina over the last 15 years or so that have had a huge impact on young children in North Carolina. And we see this impact in kids coming to school in better shape, healthier, better able to take advantage of schools, and we've seen this impact show up in our improving school performance of children in North Carolina. So there's a lot that we've done. And one of the points I wanted to make that I think was inherent in Jack's comments here, but I don't think you said specifically, is that we do have to be careful when we're using science to help guide policy, that we don't rely too much on any one study. The hallmark of science is replication. Can you show that the same thing, different researchers studying the same issues get the same results? This is important for understanding science, because if you read the papers like I do, there's a lot of questioning of science that goes on in America now, and whether the scientists are biased, whether they are looking for an answer and find that answer when they look for it, or whether they're taking an independent view of this. So having multiple studies done by multiple researchers is critical in helping us understand what we want, how we want to use science. We've tried to follow that very carefully in North Carolina. So now, what's next? We've been moving toward a true system of services in North Carolina. It's been a very gradual move, and it kind of fits and starts. But for us to put together all of these services that we are providing is a real challenge for us. And while I think right now, I'll come back to this again in a minute, there's a lot of focus on how do More at 4 and Smart Start fit together, but the issue is actually a good bit larger than that. Those are 2 of the 5 major systems that we have for serving young children in North Carolina. We have a very large Head Start program in North Carolina. We have a huge child care program, Cindy Bennett here in the front. We have a huge child care program in North Carolina. We have a large early intervention program, and then we have More at 4 and Smart Start. Those 5 large programs and several smaller programs are all serving this same basic population of children. Each has its own unique and very important way of doing that, but we need to be thinking more critically about how those fit together. And this discussion about More at 4 and Smart Start is a piece of that. But as making decisions about how to do that, we need to make sure that we take a look at the whole picture. We have to, I would say that in our country we're in a time of increasing stress for families and children, and we need to be sure that at this particular point in time we don't interject in a way that interferes with the ability of our systems to support those children and families when they're in the most need of that support. So I would encourage those of you who are in the legislature and who are new in policy-making positions in North Carolina to say that we need to make changes. We need to look for ways of improving services, for increasing efficiency of services, but we need to be sure that we're not damaging those services at this critical point in our time. There are ways we can do both of those things. We have to be sure, an important part of that, this is really a continuation of that, or an important part of that is understanding the financing system, but making sure that that's not the only thing that's driving the system. Our real ultimate thing here is how can we provide the best services to the youngest citizens in North Carolina. Another point that I would raise that's particularly comes out of Dr. Shonkoff's comments here is the importance of the very earliest years. This is an area that I think in North Carolina we've paid less attention to, and we know that children who are in infant toddler care in North Carolina are in the lowest quality care of any of our children in North Carolina. Our own studies here show that quality of child care in North Carolina decreases with age. So the youngest, very youngest children in North Carolina have the worst quality care, when we know that that's when they are the most vulnerable. We've got to figure out a way to address infant toddler care, and services are available to those very youngest children. We have to make sure that we don't let these short-term issues that we're facing today overshadow the long-term needs of children in North Carolina. We're not going to see the results of the work we do now for a number of years till these kids move into high school and on beyond and into the workforce. But we need to be sure that we're addressing those problems now to make sure that they'll be able to adequately address the issues that face them as they become adults. We have a difficult few weeks and months ahead of us. We can be divided and fight with one another for what we think is best for our own organization, or we can join together to make the best decisions for our children and for our state, guided by the best information science has to offer. I hope that we make the latter choice. Thank you very much.